Okay, hi everybody. This is our Ultrasound CDM project done by Andwrayea Partlow and Evie Lee. So first we will discuss my article, which is Article 1. I looked at the article that dealt with temperature changes in human patellar tendon in response to therapeutic ultrasound. So for my article, it took a group of 16 patients, half were male, half were female, and they were all between the ages of 21 to 23. The treatment was done on the right patellar tendon of all patients, and the treatment that was used was therapeutic ultrasound. Patients were excluded from the study if they had a localized infection in the area, swelling, or any injury to their patellar tendon on the right side. Independent variables of this study included treatment size and time, and then the dependent variables included the temperature. So this article looked at a treatment size of 2 ERA and 4 ERA, and the treatment size of 2 ERA ended up being more effective and had longer lasting heating effects than the treatment area of 4 ERA. I came to the conclusion that the level of evidence for this article was a 1B, and it scored a 6 out of 10 on the Pedro scale, so it's not necessarily the best article to use as a resource, and below are the items listed that the article received a yes for.
So for Article 2, I went ahead and appraised that article. It dealt with the comparison of effects of an exercise program, pulsed ultrasound, and transverse friction in the treatment of chronic patellar tendinopathy. This was a randomized control trial. There were 30 patients selected, and they were all recruited from the Rehabilitation and Rheumatology Center. They were all recreational athletes, and they had to have tenderness over the inferior pole of the patella for a minimum of 3 months. There were 3 possible treatment options. Each were randomly assigned to a group, and the groups consisted of either exercise program, pulsed ultrasound, or transverse friction. Within the exercise program, they did quadricep and hamstring stretches before and after unilateral squats. For the pulsed ultrasound group, they used a frequency of 1 megahertz and intensity ranging from 0.4 to 0.8 watts per centimeter squared with a pulse duration of 1 to 4. For the transverse friction massage, there were 10 minutes per session that were executed by the therapist. They measured for pain using terminology such as worse, no change, somewhat better, much better, or no pain. And they did this after every treatment, and then again after 4 weeks post-treatment, and then again after 8 weeks post-treatment. The study showed that all 3 treatments decreased pain, but the exercise program showed the greatest difference. This was given a level of evidence of 1B because it was a randomized control trial, and it received a 6 out of 10 on the Pedro scale. Using these articles, we developed a PICO question. In a collegiate-aged athlete, how effective is the use of pulsed ultrasound compared to an exercise program when working to decrease pain in a patient with patellar tendinopathy? We decided to sit down with our preceptor and discuss what their perspective was on using pulsed ultrasound or exercise program when dealing with patellar tendinopathy. My preceptor was Brianna Luth. She has treated nearly 100 plus patellar tendinopathies. She's had a great success rate. Every player has returned to play. But her method was a little different from our articles. She used mainly heat and ice with instrument-assisted soft tissue mobilization. Depending on the patient and the circumstance, she may use exercises with stretching, but that was very rare. She found that heat, ice, and maintenance is really the key to recovery, and she also doesn't really utilize ultrasound on a daily basis because there's not enough evidence to support it, and she views it as better for short-term care.
Okay, I also spoke on the topic with my preceptor, Kevin McNamara, and he has worked in a variety of settings, so he's dealt with this injury quite a bit, in his words. He prefers the use of ice and rehab together compared to using ultrasound. He's not the biggest fan of it. He mentioned that sometimes he'll utilize a TENS unit and massage if necessary, if he wants to try and loosen up the area more or focus a little bit more on pain. But so far he's had a pretty great success rate with his treatment plan of ice and rehab, and all of his athletes have returned to play with no issues. He thinks that if you're going to use ultrasound, it would be best to combine it with some sort of rehab program. He doesn't find ultrasound to be quite effective on its own, but he doesn't find it to also just be completely negative in treatment. He recommends the use of eccentric exercises, anything weight-bearing, and closed chain exercises, and phonophoresis if you're feeling a little fancy. His philosophy is he tries to keep everything simple before he needs to move to something more complicated. He wants to start at like the baseline first before he needs to try and work up. So after looking at our articles and our discussions with our preceptors, we came to a clinical decision. So we determined that an exercise program consisting of exercise and stretching is most effective when paired with ice. And pulsed ultrasound can help in the short term, while we found that exercise seems to be better for more of a long-term effect. If you want, you can try and use pulsed ultrasound as like a last resort kind of thing, but we also, like I said, found that it's more effective if it's combined with some sort of exercise therapy if you want more of a long-term effect for your patient.
So in a collegiate-aged athlete, how effective is the use of pulsed ultrasound compared to an exercise program when working to decrease pain in a patient with patellar tendinopathy? We have come to the decision that pulsed ultrasound is not as effective as exercise programs, so exercise programs should be your main source of treatment.